Hello, this is Dr. Yates, and I just wanted to take you through, this is a routine post-op visit, and this is one of my patients, Carl, and we're just going through a couple things as we always do when we see our patient's back, just going through the chart. And we did an artist procedure on him, and we've also done a FUE procedure on him as well. I think total grafts that he's had on his head right now from where we started has been close to around 3,000. Almost something like that. So I was just examining the back and I was examining the front, and I have to tell you, this is really good work. He has, I think, a great result, and the way I measure the result is we look at the pre-op pictures, we go over his restoration goals, we look at the back and the front, because a lot of patients will just concentrate on the hair in the front. Because when you watch TV commercials, all they show is, afterwards, hair in the front. But the back is equally as important. The back has to look good and the front has to look good. So we always take pictures of our patients before, and if they allow us to be on camera to show that picture. He hasn't seen this picture now in almost a year, so I'm going to show him this picture first, as I always do. I show him and say, "Is this you?" So I want him to look at this. Carl,
oh my God,
is that you?
That's me, absolutely.
Are you sure?
Yeah.
I'm beginning to sound like a lawyer. Does that represent you?
Oh yeah, this is me. I don't want to look at my picture again. Don't worry.
Okay, so I want to come in with the camera a little bit so everybody can see that this is actually him. And you can see that he has a little bit of hair up front. Okay, just a little bit. But now if we can show his hair right now, take the camera, let's take a look at his hair. He's got it styled really nicely, and he looks like $1,000,000. I would say from this picture to what I see now, I don't even think he looks like the same guy. He looks a lot younger. His face looks smaller. He looks happier.
I am, absolutely.
Well, he has on a cool shirt here too. He's got on a cooler shirt now.
Thank you.
So take a good look at that. Hold that for me, Carl. So what I'm looking at here is the hairline looks beautiful. It looks completely natural. These are the things I look at. Naturalness trumps density. Well, I say that to every patient. You want both. In a perfect world, you want it to be dense and natural, and that's what we're shooting for. But how this looks so natural, if I always imagine myself, if I were to see him out in public, would my eyes go to his hair? It would not. My eyes would only go there for a fraction of a second to say, I like his hairline, it looks great, I like his hair. I wouldn't think twice about it. Now, when we go through the back, and we'll show you, turn a little bit here, Carl, this way. Now, come through the back here with the camera. For somebody who's had 3,000 grafts or so, you cannot see anything. Now, a lot of times when you have a strip scar, people will say you can't see anything. But you know what? You can feel something. There's a healing ridge where that scar has laid down collagen. I feel nothing on his head. His head feels virginal to me. So just not seeing the scar and not feeling the scar is huge, okay? It's actually huge. Okay, now I want you to turn around and let's ask Carl a couple questions, and all these things, I want you to be honest. If you want to say something, it will be a learning experience. So what do you think about your hair, first of all?
It made my life totally changed forever. The way I used to look from here, I don't want to remember myself this way. Actually, I had so many consults for last 5 years with the other doctors everywhere. Here and Canada and in the United States, everywhere.
You went to Canada?
Yes.
Wow.
I used to live down there before, so I had like 3-4 consults. And they all wanted to do the FUT, the strip method. I didn't want no scar on my head forever. I don't want to remember anything like that. So I was researching a lot, and one of my best friends, he is actually a commercial person. He comes into the commercials, he presents the ads for
like TV?
For the TV shows like that. Right. And then he had a procedure done, and I asked him, who did you get it from? He mentioned Dr. Yates' name. So in the beginning I didn't believe, I thought maybe, every doctor is the same. But when I had a consultation with him the first time, he explained to me how it works, how the FUE works, and I was much concerned about the pain and the results. The way he angled my hair and everything, I'm totally happy about it, and here are the results, to be honest. And my life totally changed. I have gained a lot of confidence, and in the morning when I get up, I used to remember my old face. Now I just pick up the comb and then gel it whatever way, you know. And most people are concerned about the aftercare after the FUE. I'm not concerned about it anymore. This is all natural hair, and I shampoo it. I don't buy any expensive shampoo.
Looks great.
Looks great.
And we always do this because sometimes when people come in, they'll have all that like dyes on their head and the products to make their hair look thicker, and he has nothing on his hair. This is just de novo, as we say. And the artist procedure that we did on here, I mean, I must say, you know, we outdid ourselves. You know, every time that people are coming back now, I'm more and more amazed with the results that we've done. So I have to say, you know, every patient that I have, I look critically at their hair and say, could we have gotten any better? But, you know, I think that we've done an excellent job. I'm very pleased. It hasn't been a full year yet from your last, you know, artist procedure. So you have a couple more months. We'll see you in a couple months, and we'll take it from there.
And also, doctor, when I look into the magnifying glass, I see more and more hair are sprouting out. They're coming.
Right.
Right? Just like buds, you know, like black, 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 little bit.
Sure.
Yeah, they're coming up, and when I just do like this, move my fingers around, I feel little spikes. So more and more are coming, and I'm happy because I can style the way I want. I change my styles every couple days. You know,
right.
I can comb it this way, I can comb it that way, and the best thing is with the artist, whatever you did, you know, the hair that you pulled out from the back, you put a very soft line in the front so I can style it good.
Yeah, that's key. Soft line in the front. You heard it from Carl. That is our tip for today, and this is Dr. Yates with another one of my patients. Feel free to email us or call us, and we'd be happy to answer any questions. Thank you.
Thank you.